Hi Jennifer, I'm Victoria. I'm one of your nurses today.
Hi, Miss Jennifer. My name is Chrisanne. I'm also one of your nurses today, okay?
How are you feeling today?
Better. In the beginning, I was depressed, but now I'm a lot better.
Okay, it's normal to feel depressed, so we're glad that you're feeling better.
Yeah, I'm glad you're in good spirits. You look much better than you were last week, so I'm happy about that.
How are you guys related?
I'm her sister, Amanda.
Okay, you're going to be involved in her treatment and bringing her to chemo?
Yeah, I'll be with her every time.
Okay. So we're just going to tell you some information about your new medication, doxorubicin. And if you have any questions, just let us know and you can interrupt us while we're speaking.
Okay.
Do you know why you're taking this medication?
Yeah, I have breast cancer, and the cells in the breast are rapidly reproducing, so this drug is supposed to help it.
Yeah, that's correct.
Okay. Your doctor prescribed doxorubicin, 60 to 75 milligrams IV every 21 days. Doxorubicin is administered through an IV injection through a central line. The drug is given over several minutes, and there is no pill form of doxorubicin, so you'd have to come in to get it done. Okay? Doxorubicin is a vesicant. A vesicant is a chemical that causes extensive tissue damage and blistering if it escapes from the vein. The nurse or doctor who is giving you this medication must be properly trained. Okay? If you notice any redness or swelling at the IV site, please let your doctor know immediately. The amount of doxorubicin you will receive depends on many factors, including your weight and your height, your general health and other health problems, and the type of cancer that you have. This is an anti-neoplastic agent, and it is an anti-cancer drug. Okay? Do not use doxorubicin if it contains particles or if it's discolored or if the vial is cracked or damaged.
So do you guys know how often you're going to be coming in for treatment?
I was told I would bring her in every 3 weeks.
Yeah.
Right. Okay. You should start seeing the effects of the med in about 10 days, and the therapeutic effects should last for about 2 weeks after the first 10 days.
So has your doctor talked to you about any side effects of doxorubicin?
He mentioned that it causes cardiotoxicity.
Okay, so basically with that, you're just going to have to come in every 3 months and get an echocardiogram while you're on the medication. Some other side effects are alopecia. Do you know what alopecia is?
No.
It's loss of hair. So we recommend that you look into getting a wig early in your treatment. So also nausea and vomiting. So we can prescribe you an antiemetic to help prevent this. Red and brown urine is a normal side effect. So if you see this, don't panic. It's normal. Another side effect is low blood cell count. So you're going to be at risk for infection, anemia, and bleeding. Do you know the symptoms for infection?
No.
Okay, so basically sore throat, chills, fever, and stuff like that. Do you know how to prevent infection?
Stay away from large crowds, hand hygiene.
Okay.
Can you show me how you wash your hands?
Make sure you get in the creases.
For 15 seconds or so.
15 to 20 seconds. A really important thing that you should know is that this treatment can only be given once in a lifetime. So after you're done with this treatment, if another doctor tries to give it to you, do not take it because it's extremely cardiotoxic. Another important side effect that you should know is that if you have an irregular heartbeat, shortness of breath, swelling of your lower extremities, or skin irritation, you should notify your healthcare professional immediately. Do you have any questions?
No.
Okay. Were you taught how to do a radial pulse?
Yeah.
Can you demonstrate for us?
Yeah, well, with 2 fingers, I put my fingers on the artery and then just count for a full minute.
Okay. So do you know what the normal heart rate is?
Around 60 to 100.
Okay.
Great. Are you on any other medications as of now?
No, but I want to talk to him regarding like anti-anxiety maybe.
Okay, we could talk to him for you. Do you know any medications that interact with this drug that maybe you should avoid?
No.
No? Okay, so we're going to talk to you about that.
Alright. Some interactions of this drug are that it may increase skin reactions at previous radiation therapy sites. Also, phenobarbital may increase clearance and decrease effects of doxorubicin. Doxorubicin also may decrease metabolism and increase effects of phenytonin. Also, cardiac toxicity may be increased by radiation therapy. Just to note, it also may decrease antibody response to live virus vaccines and increase the risk of adverse reactions. Okay?
Okay, so just so we know you have an understanding of everything we said to you today, can you repeat back a couple important things that we told you?
Yeah, due to the cardiotoxicity, I have to come in every 3 months for an echo. I have to avoid large crowds. I have to look for signs of infection, and if I have any, let my provider know. Definitely look into a wig because I might be losing hair soon. And
Okay. And just don't forget that this drug is only given to you once in your lifetime.
Well, thank you for letting us know. Now we know that you have a better understanding of this drug and what's going to be happening, okay?
Okay, so thank you for coming in today, and we hope that this helped you understand more about the drug, and we'll see you tomorrow at the beginning of your treatment.
Okay, thank you.
Thank you.
Thank you.
Bye.